A healthcare proxy is a person who will make decisions for me about my medical care when I don't have capacity to make those decisions for myself.
Someone you trust.
An advocate, someone who's a voice for your healthcare decision making.
My healthcare proxy is my wife.
My alternate, I've got my best friend.
My healthcare proxy is my mom.
If circumstances change and you want to designate somebody else, you can always change it at any given time.
I think a healthcare proxy is important because one never knows when you might need somebody to be making important decisions on your behalf.
I don't actually have to imagine why it's important. I've actually lived through it, where my dad became very ill, and fortunately a month before we had a conversation about this, and I was his healthcare proxy and had to really carry out some of his wishes. Even though they were very difficult, I was comforted knowing exactly what he wanted to happen.
Mostly when people are talking about their wishes, it's really about what are the things that matter most that would make life worthwhile and make worth living to keep going if you're at a situation where you're uncertain.
That's going to change over time, so these are continuing conversations. When you're 25, what you want to do is different than when you're 85 or 90 years old.
I think it's very important that your doctor and the folks taking care of you know your wishes and know who is delegated to speak for you.
Especially, your primary care physician, he or she definitely should know about it. And if you have a specialist that you see, a heart doctor, or let's say if you're a cancer patient and you see an oncologist, it's important to let all these medical providers know.
When patients don't have a healthcare proxy, we're not always sure exactly what their wishes may be, and it becomes a lot more difficult to make decisions on their behalf.
We have to make assumptions that we know what's best for the patient. And we do that in a very well-intended way, but we oftentimes don't really understand the context of that patient's lives.
We are anxious to, whenever possible, eliminate that ambiguity and be sure that we are acting in a way that is most consistent with what we know that person would want.
It's important to actually have these conversations when you're healthy and when you have the ability to really express your wishes.
So pre-planning is just much easier for everybody.